Let us call the meeting of the Finance and Planning Committee to order for February 7th and ask that we call the roll.
Sure, I'll start with you, Commissioner Chow,
Present.
and Commissioner Guillermo.
Present.
Thank you. I will read the land acknowledgement.
Thank you.
San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community, and by affirming their sovereign right as First Peoples. We can move on to item 2, which is the approval of the January 3rd, 2022 minutes. And if I may, I just want to call out a few corrections that Commissioner Chow sent me, and they were my mistakes, so I apologize. On page 2, under third Commissioner comment, on the third line, I had the word under and had left out stand. So the phrase should say helping providers' ability to understand young children's issues. And then below that, 1, 2, 3, 4, 5. On the 5th Commissioner comment, it was you, Commissioner Guillermo. I had a sentence that said contract monitorings will be concluded on site this year, and it should be conducted on site. So I changed that. And then finally on page 3, the first action item taken, I crossed out the recommended. The full Health Commission approved the report. It just was a phrase left over from a cut and paste. So I apologize for those administrative mistakes on my end.
No problem. I think it's just to clean up our little typos. There are so many things you have to do, but thank you so much for suggesting those. And a motion is in order to accept the minutes with those modifications.
Second.
Great. And so I'll check this one person on the public comment line. Person on the line, if you'd like to make public comment on this item, which is item 2, please press *3 now. All right, I see no hand, and I can take that. Since there's only 2 of you, a motion and second is all we need for the action, and we can move on to item 3, the monthly contracts report.
Thank you. Let's proceed, and would you call the items, please?
Yes, item 3 is the monthly contracts report, and Mr. Goodwin will call out the contract.
Oh, good.
Good afternoon, commissioners. We have 4 items on the monthly Health Commission report for February. The first item is Swords to Plowshares. Today we are requesting approval of a contract amendment with Swords to Plowshares to increase the total contract amount with contingency to $5,864,345, or an increase of $2,515,159, and to extend the current term of 7/1/18 through 12/31/23 to 7/1/18 through 12/31/27, an extension of 4 years for a total contract term of 9.5 years. The current contract amount of $3,349,186 was previously approved by the Health Commission on December 4th of 2018. The purpose of this contract is to meet the needs of veterans, ending and preventing homelessness, reducing hospitalizations, reducing the harm caused by substance use, and reducing recidivism rates through supportive services provided with dignity and respect. The proposed amendment exercises option number 2, authorized under RFP 8/2017. This annual increase is due to 3% annual cost of doing business allocation. We have Tomiko Aya, Program Manager with Adult and Older Adult System of Care, to speak to the earlier submitted questions regarding the BOCC monitoring report notes on this program and any other questions you may have.
Thank you. Proceed.
So there was a question regarding why there wasn't a plan of action for some of the deficits in the performance review by the business office. Basically, all of the contracts during the beginning of COVID were waived. The performance objectives were waived for all the programs, given how the pandemic affected how people were able to provide services to our clients. So that's number one. Number two, I did go over the objectives specifically regarding the cover program, and the cover program it actually targets veterans in jail. So, and it's also a work order through the sheriff's department. So that is not under the same performance objectives. So I had them develop separate ones for that program. So that wasn't maybe necessarily addressed in that report. I did forward those to the BOCC.
Thank you. Let me find out, Commissioner Guillermo has also any questions before I ask you one more.
Thank you. I don't have any other questions.
Okay, so understanding that this has been a long-standing organization, and they certainly target very important people, and being a veteran, I'm very sympathetic to our needs to try to approach them. That's why I was a little disappointed even during COVID that they weren't able to actually assist their clients more than they did. And I understand that this is kind of, if they didn't do it, they don't get paid. But it also seemed to say, and I did read the full report, that some of this was due to new leadership. So how confident are you? Obviously, you put this proposal before us with a continued contract a year for the next 4 years. So as the manager of this, are you confident that this year they have turned things around enough to really be productive for us?
Yes, I am confident. They have hired 2 new folks for the program, and yes, part of the problem is that they lost staffing, including in leadership for this program, and therefore they weren't able to meet their deliverables as we had hoped. So that has been fixed in terms of them being able to hire into positions. And so I think that we will see a difference in the numbers and the people served.
Okay, and I do appreciate the report that you sent us, which was helpful in terms of explaining more what sounded like kind of a lack of assistance and supervision for this. So thank you. I don't have any other questions on this unless Commissioner Guillermo does. We can go on to the next item.
Yes, that's fine with me.
Thank you.
Thank you.
Thank you, Tomiko. The second item, we're requesting approval of a contract amendment with the Regents of the University of California, San Francisco, the Alliance Health Project, or AHP, to increase the total contract amount with contingency to reflect $6,730,910. The contract term of February 1, 2017 through June 30th, 2026, which is 9.42 years, will remain the same. The contract provides Getting to Zero, or GTZ, funded intensive case management services in psychiatry, as well as other mental health services targeted to long-term survivors of HIV living in San Francisco. The proposed amendment is authorized under RFP 24/2016. Department is requesting approval of a total contract amount for the $6,730,910 due to the following changes: a general fund cost of doing business increase in the amount of $112,164 for fiscal year 22-23, and through fiscal year 25-26 of about $28,041 annually. A general fund board of supervisor add back funding for long-term survivors in the amount of $395,216 for fiscal year 22-23 through fiscal year 25-26 of $98,804 annually, and 3, a decrease in the amount of $51,049 to the 12% contingency value applied only to current and future years. Previous contingency amount was $448,423. Current contingency is $397,374 for current and future years. The annual funding was decreased by $104,920 due to a decrease in one-time general fund carry forward in the amount of $231,765 for fiscal year 22-23, which was partially offset by an increase in the general fund CODB in the amount of $28,041 for the current fiscal year, and an increase in the general fund BOS add back for the long-term survivors portion of the program of $98,804. Beth Neary, Acting Assistant Director of HIV Health Services, is here to respond to any questions the commissioners may have. Thank you.
So I guess I'm a little confused with the math because it says that we're adding, and yet it shows an annual difference loss of 104,000. And I'm sure your math is correct, but could you give a simple explanation? I understand there's an add back in here, which then should add more money as versus then a loss that you're showing us.
Thank you, Commissioner Chow. There was a carry forward of unspent dollars of general fund for the previous year, which is not reoccurring this year. So that's partially offset by the add backs, but the overall decrease is 104,000. So if you look that 231,765 was carry forward one-time general fund in the year prior, that's decreasing this year because that's been removed. And I'll ask Beth to confirm that for me. Is that correct, Beth?
Yeah, that's right. The 231 was enriching their budget last year, and once that was removed, then almost 100,000 in new board of supervisors add back, and about $30,000 in CODB were added. So
Okay.
the net is a decrease.
So the net's a decrease, and the reason that we're going to the amendment is to add the new dollars, even though the old ones, which were more, have gone away. Is that kind of the
Yes.
simple math here? Okay.
Because it's a multi-year agreement. Last year, just that 1 year was increased because it was a one-time carry forward, and the future years were on the budget at the underlying normal amount. And then now we need to go back. The future year, the first year we are now in, and then the additional, we need to add in the $30,000 and the $98,000 for several years, about 4, I think.
Okay. Thank you. So there's the one-time add back that was lost, and then we're adding some additional money, but it didn't quite make up for the add back that we the 1 year, and that's why the total is 109,000 less, right?
Exactly.
Okay, just in case somebody asks, because it looks strange to add and then have a negative. Okay, Commissioner Guillermo.
I don't have a question on the merits of the program, and it's just I'm still just trying to understand the carry forwards, the add backs, the decrease, just generally how that works with regard to the general fund. And I think it's more of an education for me about how all of those general fund flows, inflows and outflows work on a long-term versus on a short-term basis. And so it just gets a little confusing because sort of not understanding the history of all of this. So just trying to get a better grasp. And I don't know if there's a place where all of the different types of general fund inflows and outflows come into play with, some of our programs, but it would just be helpful to have some reference point for that at some point.
And so I think Commissioner Guillermo's concern expresses why we're still sort of confused, but there was, let me see if we got this clear. There was a one-time carryover that then has gone away, which was substantially more money than what you're now adding into by way of Board of Supervisor add back and the cost of living increase. So it causes a $104,000 annual difference.
Right, when compared to last year's fiscal year.
when compared to last year, right? Because last year had the bigger amount, right?
Right.
Due to the one-time add back. So it's a comparison to the prior year rather than the entire contract, I think, which is the confusion here.
Can
Does that help, Commissioner Guillermo?
It sort of does. I guess what I was wondering is this, the add back funding for long-term survivors, is that sort of a designated add back fund, or is it something that is intended to make up for other kinds of deficiencies in, or to smooth out, a funding a funding budget for this program or a range of programs? I'm just not understanding that particular long-term survivors funding add back.
okay,
So-
Dean, shall I take that, or would you like to? I'm very happy to.
Go ahead, Beth.
Perhaps the whole question of the Board of Supervisors add backs are really what this is, because at different times, as I recall, the supervisors have certain projects that are brought to their attention that they would like to maintain. While they don't name where it goes, they can say that they would like continuation of lollipops to be given out. But there's only one place giving out the lollipops. So then after they've passed the budget, we then have to put it into a contract for the people who are putting out the lollipops. Now, as I read this, and you can tell me if I'm wrong, the Board of Supervisors decided that they didn't want to have a loss of the long-term survivor program, and they added money back into that, which was going to be lost of 98,000. Is that right?
Actually, this is a very unique one.
Oh,
I'll just tell the
I
whole story because this whole contract is of origin from Board of Supervisor add backs. We do in
Oh.
HIV Health Services have a set of contracts with Alliance Health Projects to do mental health and case management and psychiatry for many of our clients that are funded by either Ryan White Part A or General Fund for HIV Health Services that isn't part of these add backs. But this particular contract originally, I think, started as a getting to zero add back, and that we actually did have two lollipop vendors that could do the service. So we split the Board of Supervisors add back amongst the two relative to how many they could. The two we had, I think we already had RFP authority, I believe. I'd have to look back, who could provide this type of service. So for the getting to zero funds, two vendors, AHP being one of it, this is one half of this contract, do that program. And that is for getting to zero intensive case management. So that provides linkages and essentially supports people who are struggling with sort of multiple healthcare problems, often including substance use or mental health, and always including HIV for this contract. So to keep them engaged in primary care and to support them with motivational interviewing and all the things that can sort of help them support their own health. So that's almost half of this contract is from that add back that's quite a few years old, and that's only just going up by cost of doing business increases that I can recall in recent years. The other half, approximately half of this contract, is the long-term survivors Board of Supervisors add back, and that was community advocacy has gotten in 2 or 3 chunks, rather now a significant amount of money. This particular year, a $200,000 board add back, but there was a $500,000 one previous to that, and that we divided across multiple programs that could provide mental health to this age cohort, of which of the 200,000, the client proportional number of that 200,000 that went to AHP was 98,000 approximately. And so we're enriching the long-term survivors Board of Supervisors piece with that subset of the 200,000. Does that make sense? And that doesn't address the one-time carry forward, which I can circle back to.
And if I may, Commissioner, thank you, Beth. Commissioner, you were a commissioner during this time, but I'm just reminding that there were some long-term HIV long-term survivors who came and talked about that there's a high suicide rate, a lot of isolation, and that community was begging for funding to help themselves because they felt like they'd been ignored and lost in all the new funding with PrEP and kind of the new world. And so the supervisors heard this, and over the past couple of years, that's where that add back, the political side of that add back money came from, where that they felt that community should be funded, and that's not the technical part, but the people part of how that money entered into our world, if that makes sense. And I think that began 2 years ago, and this is the second part of that, where if they don't spend the money, then they roll it over the next year to make sure it's not lost.
All right, that really helps. Thanks. Both uh, the
Yeah,
explanation of where the money came from and how and why. Yeah, thank you.
okay, well, thank you. And of course, it's good service. So if we have no other questions on that, we can go on to our next contract amendment or action, I guess.
Will do. Item number 3 is for Cross Country Staffing Incorporated. It's the approval of a new 3-year contract to continue existing services in the amount of $5 million to provide as-needed temporary radiology registry services to the San Francisco Health Network and other network facilities, including partner sites, for the period of January 1, 2023 through 12/31/25. I just want to note, as it is on your handout there, that the current contract information in your monthly Health Commission report represents information in the previous contract that just ended 12/31/22, and is represented here only to provide a comparison of the new contract to the previous services. Cross Country Staffing was recently selected under RFP 7075, resulting in this proposed new contract. It was one of 4 awarded providers for radiology services under this new RFP. There was a continuation of an existing services procured under a previously awarded contract in RFP that expired on 12/31/22, as I just said. Utilization varies due to the need to provide services for unfilled positions and unanticipated staff absences. The department is requesting approval of the total contract of $5 million, which is a decrease of $4 million from the previous contract amount of $9 million, due primarily to the length in the contract term being decreased from 5.4 years in the previous contract to 3 years in the new contract. The decrease is the annual difference is attributed to less DPH vacant positions, meaning the department has filled some of these vacancies, thereby reducing the needed usage for as-needed registry services. The proposed total contract amount of $5 million includes $4,464,286 and a 12% contingency amount of $535,714, which is applied through fiscal years 22-23, fiscal year 25-26. Valerie Williams, Assistant Director of Radiology and Imaging, and/or Loretta Johnson, Interim Director of Imaging Services, are available to answer any questions you may have.
I had just a question on the duration of the contract, a reduction from 5.4 years to 3. Is that because there's an anticipation that there'll be a new RFP coming out on that, or is it because there's an anticipation that there won't be as the services needed beyond 3 years? I'm just sort of wondering why there was the 2.5-year reduction in the contract duration.
You know, I'm not entirely sure, Commissioner Guillermo. I'll get the answer for that and provide that to you. It may be. I would suggest it might be to with the decrease in the amount. It may be to get a sense of how much is needed moving forward and look at doing that again in a few more years, as opposed to having a longer term contract. But I'll check and follow up and provide that to Mark and get back to you.
Thanks.
Sure.
Okay, I think this is similar to a previous contract, right, with another contractor in terms of radiology services. I think we had last time. Right. Okay, if we have no further questions on that, because we know, and I guess that's good that we need less, then we can go on to our last contract.
Absolutely. The 4th contract is for Trifecta Incorporated, the approval of a contract amendment to procure additional as-needed nurse registry services for the Department of Public Health. The department has experienced a great increase in the need for as-needed nurse registry services. In addition to past issues such as COVID and other emergent issues, ongoing recruitment and staffing issues continue to drive the need for nursing registry services. Laguna Honda Hospital continues to experience many vacancies among nursing staff due to retirements, resignations, and staff leaving for other positions. Regional and nationwide challenges in recruitment and retention of nursing professionals continue as part of the trend as well. So the annual amount of this as-needed contract has been increased to be better able to meet this need. Excuse me, Maria Rowella Antok, who's the nursing director for nursing operations at Laguna Honda Hospital, where the majority of the trifecta resources are utilized, is here to respond to any questions you may have.
Commissioner Guillermo.
No questions.
Okay, so as we're looking at this becoming, I guess, as I think the bulk being Laguna Honda, these are different positions than our HSAG contract then is covering. Is that right? I mean, are these the line staff? And I didn't recall that the vacancy rate was so high that you needed so many. So it was just sort of a question. Obviously, we need whatever we need, but there seems to be a discrepancy between what the vacancy rate seems to show and what this seems to say, that you need a lot more registry.
Maria, you're on mute. Sorry. Thank you.
Sorry. Good afternoon, commissioners. So since last year, we had about 35 RNs who transferred to other DPH department and facilities. We also have several staff who resigned or retired since we lost our certification last year. As of today, we still have about 52 vacancies. This is a combination of 15 PCAs, we have 19 LVNs and 21 RNs who we are actively recruiting right now. We also have around 130 nursing staff on different types of leave. So this pertains to 67 PCAs, 19 LVNs, and 27 RNs on different types of leave. So to help us with our staffing challenges, we have been requesting registry to provide us with a 13-week contract for now. So just for the past month, our current average registry usage is around 9,000 hours per month due to the reasons that I mentioned earlier. So I was hoping to, ask the commissioners to, provide us with our ask so that we can, achieve our goal of certifying this year. Also providing, services and programs to our residents.
Okay, very good. Commissioner Guillermo, as our chair of Laguna Honda, does this make sense for us?
Well, it is actually, a concern I know that we have around staffing, given that we haven't achieved recertification yet. So I understand the need to make sure that we are not going to fall behind or fall back in the interim until we achieve recertification. So I would imagine that we'll be taking another look at this once we do get recertification and are able to assure prospective clinical and other staff that there will be a continuation of the hospital into the future. So I do understand the need to make sure that we don't have any holes in critical areas.
Thank you, Commissioner.
I think that's very well said. Thank you. So, Mark, do we take a vote on recommending this to the commission?
Yes, sir. And there is somebody in the public comment line, so the two of you can do motions, and then I'll check the public comment line and get back to you, if that's okay.
That would be fine.
Okay, I'll move approval or approval to recommend to the full commission on the contracts report.
Okay, I'll second that, and we can take our public comment.
Sure. Person online, if you'd like to make public comment on the contracts report, item 3, please press *3. All right, I see no hand. And so since the two of you are all that's here, your first and second is the action we need, and that is a recommendation to go to the full commission for approval. We move on to item 4, which is a request for approval of a new contract with Health Right 360 to transition two existing programs from Baker Places.
Okay, I can introduce this. We have a request for approval of a new professional services contract, as Mark said, with HR 360 to transition two existing programs from Baker Places, Joe Healy and Acceptance Place, with the continued goal of reducing the impact of substance use disorder and addiction on the target populations being served. Total proposed agreement is $9,414,414, which includes a 12% contingency for the term of November 16th, 2022 through June 30th of 2024, about 1 year and 7.5 months. The medical detox program or withdrawal management provides integrated substance use disorder and mental health treatment in a safe, recovery-oriented environment. Each patient's treatment experience is unique. Its services are assessment-driven and strength-based and participant-centered. This was previously the Joe Healy program. And then the Acceptance Place Residential Substance Use Treatment Disorder Program provides integrated substance use disorder and mental health treatment in a safe environment tailored to serve gay and bisexual men recovering from chemical dependency. And again, each participant's treatment is unique. Its services are assessment-driven, strength-based, and participant-centered. We have Kelly Hiramoto of the DPH Business Office, who's serving as the acting PSC coordinator and leads special projects. And Jose Luis Guzman, program manager of adult and older adult substance use disorder system of care, who are here to provide more program details and answer any questions you may have, as well as other staff from HR 360. Thank you, commissioners.
Mark, perhaps we can take public comment on this one before we have our commissioner comments.
Sure. First online, if you'd like to make comment on this item, please press *3. We are on item 4. No hand, commissioners.
Okay, thank you. Commissioner Guillermo.
Yeah, I have a couple questions on this. One, I understand the history of why these services are being transferred to Health Right 360. The first question I had was, is the funding for this contract through June 24, is that a different amount than would have been funded to Joe Healy or to Baker's Places? Or is it the same? I'm just sort of wondering whether there was any adjustment that needed to happen in the amount given the transfer.
Good afternoon, Commissioners. This is Kelly Hiramoto, Special Projects Manager with Department of Public Health. The budget allocation is pretty close to the same. It's a slight adjustment higher because Health Right 360 pays their staff more than Baker did. So there was an accommodation for that. But in terms of program expense, it was fairly lateral.
And then the second question I had was, if this contract only goes to June 24, what is the thinking or what is the plan for an RFP to continue or to transition these services either out of Health Right 360 to another or original provider or to another provider?
So the need is to resolicit for the service line anyway. So it's why we asked for it to extend till 2024, because the RFP, the contracting authority, was going to be winding down anyway. So we're going to resolicit for these substance use services as a whole.
Thank you. Then I would ask, just because again of the history of these particular services and the sort of swift nature of having to transition the services, if we on the Finance Committee could get more of a heads up on the solicitation so that we might be able to sort of take a look at what is being required, what is being required, and making sure that the beneficiaries of these services aren't going to be aren't going to be compromised as a result of another sort of solicitation or discontinuation of the services. It just again, because of, again, the history, I don't, I don't know whether we have gotten any sense of the impact on the clients, given the transition. Uh,
Sure. So I can certainly speak to the detox is a short-term model of care. Folks generally stay 3 to 5 days for the detox portion of care, and so the disruption was minimal to the client simply because there was nobody in the program that had to get relocated. And then the same for the acceptance place program, although it's a longer stay program. The transition happened in purposely where we made sure that no client was transferred. We waited till last client discharged from the existing acceptance place before we had started accepting new referrals at the new location for acceptance place. There was good service continuity because the majority of the staff that were at Joe Healy and at Acceptance Place opted to follow their programs. And so the program model stayed similar. So a lot of the clients, if they were repeat users of the service for like a detox, there were familiar faces for them to see at the new location. And with Acceptance Place, most folks graduate out and move on to other things. And so they're not repeat customers, generally speaking.
Okay, thank you.
Thank you. The latter question was where I was also curious, and I think you answered it by saying that a great number of the personnel had transferred over, because I didn't know where the expertise was going to come from for sustaining these programs. Are these programs, or I'm just thinking now on a physical basis, are they located in the same spot, or are they moving to some sort of Health Right 360 site or sites?
Sure. Both programs were relocated. Health Right 360 took the detox and actually partnered with its existing detox program. So it had a social detox model. And so now it has a double component of a medical detox that then folks who are ready to move on to continuing treatment can then transfer to social detox at the same location. And then for Acceptance Place, they also had a similar type of programming that was offered at 890 Hayes. And so they had space there that actually could accommodate taking Acceptance Place in as a standalone program, co-located at that address. So both programs will have moved.
Okay. And I see that Health Right 360 has like 70 odd million, give or take a few million, of our contracts. And this goes back to Mark. We were going to try to create some sort of dialogue about these large contracts. And I know that Chairman Chung had wanted to get that onto the agenda. This just sort of reminds me that 72 million is bigger than the budgets of many states. So I think we really need to have some sort of shorter time frame to try to really look at how these mega agencies, especially in the face of what's happened to our recent partners, that what are the safeguards around how we are going to be monitoring them. It sounds like normal monitoring does not exactly work.
Thank you, Commissioner. A first step in that process for the full at the March 7th full commission meeting, the commission will be hearing an update, a general update on DPH monitoring of contracts, and then going into some contracts that had issues during COVID. And then at that meeting, I think you all can request what you'd like the next step. And obviously, one of that might be to have Commissioner Chung calls them the too big to fail contracts, and to have an analysis of that. But we're hoping to do a stepping stone thing where the commission itself can ask an iteration so that the staff can respond appropriately as you all are learning and discussing each piece. That makes sense. But I am noting your request again, and staff are hearing that, and I'll check in with them too.
No, I think that's progress. I do believe that it'd be great that we have the entire commission hear the whole issue, and then component, and then Commissioner Chung and ourselves can then hone in on what on the finance side we would like to see. So appreciate that's going to be coming up a lot sooner, and therefore we'll look forward to that. Commissioner Guillermo, any other comments before we look for a motion for a recommendation to the commission?
No, just noting that I guess it's fortuitous that that meeting will probably be the first meeting that we all are going to be gathered in person again. And so it will, I think it bodes well for that being on the agenda as one of the critical items I think that we've been discussing for a while. Yeah.
Great.
Right. Okay, so I think we're ready for a motion for a recommendation to the commission.
So I will move to recommend approval of the Health Right 360 contract.
And I would second that to the commission, and I think that actually carries.
Yes, of course. Thank you. Ms. Hiramoto, I know this was off topic, but you had thought that you might be able to get some commissioners. Commissioner Gerardo asked about, there's an issue on a separate program, Baker Places at Grove Street, and she'd asked in this contract to see if we could get any information about the Grove Street issue that some neighbors are complaining. Just trying to note that there are some issues with the program and that Baker Places is already kind of a contract that has issues. Ms. Hiramoto, any information as we piggyback on this before we move on?
Sure. So they are, the department is actively working in partnership with Mayor's Office of Housing Community Development to continue to work with Baker, PRC Baker around resolving the neighbor concerns. I checked in with Baker, and there was some additional window darkening that was supposed to have happened that is in progress. There was an issue with, like all things supply chain contracting. So the goal is to get those final windows with a coating on them to block out more of the light. There's a couple of other lighting issues that are under review about how to mitigate, but they're all being addressed. And both the community members and Baker have been in contact with each other to try and continue to work on the problem.
Thank you so much. I'll pass along to Commissioner Gerardo.
Super. Thank you so much.
Thank you for checking. And we can move on to item 5, emerging issues.
Well, I think we already discussed the big emerging issue, so
Yeah.
look forward to the March meeting.
I would like to ask Ms. Ruggles, if you're here, can you briefly, verbally, just summarize the email you just sent with the new policy regarding delinquent contracts, so that this group can hear that and we can discuss it at a different time?
Sure. Hi, good afternoon, Commissioners. Michelle Ruggles, Department of Public Health, Business Office. So the, sorry, I probably missed, I know it. So the state AG has a process where vendors that fundraise or receive fundraising have to register, and then the state Attorney General takes their annual submission, their form, and I think it's around $300, and reviews it. And they're doing that to make sure, as I understand it, that that vendors that receive fundraising are using the fundraising dollars appropriately. That has not been on the checklist, which is probably 100 items that get checked through the city. It's not something that the city departments have checked. It's been between the state and the vendors. And so what happened was a reporter identified this issue and presented it that all the contracts, what they did is valued all the contracts, the whole funding, and reported that all these vendors that the city is paying are they're not in good standing with the state. And so there's actually 3 levels of not in good standing with the state. If you haven't submitted your annual documents, then you're delinquent. If you submitted your documents, but maybe you used the wrong form, the state updated their form during COVID, you paid your check, that you had a balance due of $25, you might not even have known you're delinquent. The state themselves, even though they say that you're not in good standing, they continue to work with the vendors. They don't revoke or suspend the vendor's ability to do business until it appears to be like several years of delinquent. So the choices are delinquent, revoked, or suspended and then revoked. And so the DPH had 27 vendors that were identified. Of those, 7 were actually current. So that came down to 20. 2 of them weren't contracts anymore. So we had 18. And of those, about half of the vendors had all submitted documents using the wrong form, had a balance due or something like that. So, and in general, what they, like, again, it's a format that gets submitted annually, form and a few $100s. So the city attorney, the controller, and the admin services developed a policy. And so if a vendor, so first of all, DPH doesn't have any revoked or suspended vendors. We have, I don't know if it's still 20 because people are getting in compliant, vendors that have a delinquent status. But so that they just issued their policy, and the controller's office reached out to all of the vendors that have actually they're all delinquent, not more. So they reached out to them, and then we'll be following up. As long as a vendor isn't subject to an amendment, which is like a formal recertification or a new contract, they're going to continue to get paid while they're remediating whatever the issue is. And the controller's office was also working with the state AG to figure out a way to fast track some of these. If we have a vendor that needs an amendment, that has to be remediated before the contract will be certified. But otherwise, payment will continue, and we'll be working with the vendors. There's not, aside from like following up, it's really the vendor fills out, submits the form, and submits the fee. And that's it. And then if they have a lot of fundraising, I forget if it's 2 million or the size of the vendor is 2 million, they might have a secondary form to submit. So we're hopeful that with all of the reminders, I did call one vendor, for example, they had a balance due, but because the check was cashed for the original submission, they didn't realize, and I guess missed if there was follow-up, that there was a balance. So I think we're on it, and then moving into the future, it will be added to the checklist of items that get checked, and new contracts or amendments won't make it through until it's done. So that's where we are with that.
Thank you, Ms. Ruggles. And I apologize, I didn't give you a heads up on that, but I appreciate that you did it on the fly. Commissioners, it's just another step in the process of trying to rectify the contracting process that you've seen in the news. So thank you. Let's move on to item 6, public comment. Person on the line, if you'd like to make comment about something that's not on the agenda, this is the time to do it. Please press *3 if you'd like to make comment. *3. All right, I see no hands. Commissioners, we're not at a place where you could consider adjournment.
I move to adjourn.
And I would second so that Commissioner Guillermo can continue to supervise her construction.
Thank you very much.
Thank you very much.
Hey, Commissioner, and thank you.
An
Everyone.
hour.